Well, the Excellence in Mental Health Act is about making sure we have enough community mental health services so people get the services that they need. Right now, we have community health clinics, and they're able to get reimbursed for services at a higher level than community mental health services are. So we want to bring parity. We want to make it clear that whether you have an issue related to your brain, a mood disorder, another brain disease, you should be able to receive the same kind of services, the same reimbursement level in the community as physical health services. And what this means practically is that our community mental health services in northern Michigan will be able to get adequate funding and work with local veterans organizations, our outpatient VA clinics, our health clinics, to put together the level of services that people need in the community so that they can get help, they can be successful. We know that if someone has a mood disorder and can get help with medication and treatment, they can manage that disease just like you would manage diabetes and checking your sugar levels and taking insulin. You can do the same thing for chemical imbalances in the brain and live long, healthy, successful lives. We also know if people don't get the help that they need, there are lost lives, tragedies for families, and unfortunately, in rare circumstances, actually violence. So we need to make sure we have strong community mental health services, high-quality services, and this is really the final step in providing what we call mental health parity. We're treating mental health on an equal plane with physical health.
Okay. And as part of that, the part of it, the bill, it will allow Medicaid to help cover that, correct?
Yes, right now we have a way of funding health services in the community. If you meet high standards, you're able to get a high reimbursement or you can get your costs covered through Medicaid. This will allow the same thing for mental health services in the community. We're setting up 10 demonstration projects around the country so communities and states can work together on how best to set up services, working with local veterans, outpatient clinics, and health clinics. And we're also requiring that to get the higher reimbursement, you have to have 24-hour psychiatric emergency services. Right now, way too many people are ending up in jail when they should be at a mental health facility getting services. And that's why we have national sheriffs and police organizations strongly supporting this bill, veterans organizations strongly supporting the bill, as well as medical associations and community mental health groups.
How many people in, I guess, the U.S., and if you, I don't know if you know enough, have it available, but in Michigan are, affected by these mental health diseases and stuff?
Well, we know millions of people are affected, and right now, less than half of those with severe mental illnesses receive any treatment at all in a year. Less than half. And for someone with a mood disorder who's viewed as bipolar or who has depression, about a third of those individuals receive no treatment in a year, and yet we know you can manage those diseases just like you manage physical diseases. The other alarming fact is that we have 22 veterans who are committing suicide every day in America. People who've put their lives on the line, fighting around the world for us. They come home because of post-traumatic stress or other emotional concerns. 22 veterans are committing suicide every day in this country. The legislation that I'm authoring is a very important step to make sure community mental health services are available so someone can reach out and get the help they need.
At an affordable cost, too, correct?
Absolutely. I
Okay.
mean, this is now we've already taken an important step. Health reform includes a provision which I authored that says insurance companies can't discriminate against mental health coverage, and you have to provide the same copays and premiums, the same access to care in inpatient facilities as you would for any other health service. So we've taken that step. Insurance companies now have to treat mental illnesses the same as physical illnesses. But for those who don't have insurance and are in the community, we still have a huge gap between getting help for physical illnesses and mental illnesses. And my legislation will close that gap. It's the final step in closing the gap and understanding that we need to treat the whole person, that healthcare involves uh, making sure you get help for illnesses above the neck as well as below the neck.
Okay. Now, what is something if this all goes through? What is this going to cost taxpayers?
To do the 10-state demonstration project will require an investment of $1.6 billion. It's part of a large health care bill moving through the Senate that is $150 billion addressing Medicare reimbursement for physicians and other issues. So this is a very small part of the cost of the legislation moving through the House and the Senate right now, and it will literally save lives and save families. I should also mention we're in a wonderful position of leadership through Michigan right now with my authoring this in the Senate and Chairman Dave Camp in the House and Congressman Sandy Levin, Chairman Fred Upton in the House as well, are all in key positions to play leadership roles to get this done. So Michigan's going to have a wonderful opportunity to really make the first step in increasing community mental health services that we have seen in probably 25 years.
And is Michigan one of those 10 states that'll be used in the pilot program?
It's all voluntary. The state will have to apply,
Okay.
but I'm sure that Michigan will apply for it.
Okay. So with that 1.6 billion, and that's over 10 years, correct?
Correct.
Okay. What would you say to people that are kind of like, oh my gosh, it's all on our shoulders then. We're all going to be paying out of this. Is that accurate? Taxpayers are going to be kind of fronting this a little bit too, correct?
Well, right now we are paying hundreds of billions of dollars in housing of individuals in jails and prisons who should be getting treatment so they can live successful lives in the community. We've seen loss of life through shootings at Newtown, through the Navy Yard here in D.C. with 12 individuals killed by someone who had a psychiatric disorder and was not getting the help that he needed. We are talking about a very small investment in saving lives, saving individuals, and allowing us to benefit from the talents of people who, with a little bit of help, are going to be able to be productive, healthy citizens.